We continue to get questions about VA healthcare coming into our Facebook and other social accounts. So today we're joined by the Durham VA Healthcare System's Deputy Chief of Staff, Dr. Christie Emler. The big question is always about wait times. What is the hospital doing about this?
Wait times are something we hear about as well. We work really hard to see our veterans in a timely manner. I can tell you right now, 95% of the patients who want to get seen within 30 days. The places that we have struggles, we're working on, and we're really transparent about that. If you can go to the website, accesstocare.va.gov, and at that website, we tell you, you can look up your clinic or any clinic in North Carolina. You can look up primary care, mental health, specialty care. You can see if you're a new patient or a return patient and see exactly how long it takes to get in. So we want to let patients know. And if you go to that website and you see that it's, say, 7 days to an appointment, that's true if you're a return appointment or a regular appointment. If you have urgent care needs, we can see you the same day in any of our sites.
How have the smaller clinics, how is that playing into what the hospital's dealing with? Because it seems to be that that's helping get some of the smaller issues out of the way so they're not having to go to the big hospital situation.
My background is primary care. I'm an internal medicine doctor, primary care and doc, and that's what the smaller clinics are about. They are about surrounding the veteran with a team of people who want to help them to the best health they can achieve. And so that includes a primary care provider that's either a doc or a nurse practitioner or a PA, a nurse care manager, often an LPN clerk, usually a pharmacist who's not in the pharmacy but out working with the patient on their medications, a social worker, a dietitian. All of those people surround the veteran and their family, help give them the tools so they can improve their health to the best they can so they don't have to go to the hospital. So those small clinics, and we have them from Durham all the way out to Morehead City in the Durham VA healthcare system, and then North Carolina has a lot of other VA healthcare systems with small clinics all the way across the state.
I know one of the issues that the VA has talked to me about is that a lot of veterans aren't using the VA system yet. Maybe they had a bad taste in their mouth in the past, or whatever the case may be. Why is the push now to say we need to serve you at the VA? Why is that? Why are you best equipped for them?
We're best equipped for many reasons, and one of the biggest ones, I think, is because we're about veterans. I'm an internal medicine doc. I could go work anywhere, but I choose to work at the VA because I specifically believe in the mission, and the mission is to improve the health and well-being of veterans. At our VA, about 30% of our employees are veterans themselves, so they truly get it. The vast majority of the people who work at the VA are there specifically to take care of veterans. So they either know the veteran story because they've lived it, or we get training and we listen, and we're part of a group of people who really want to care for veterans specifically, not just any patient, but a veteran. So when veterans come, they get somebody who understands what their deployment was about. They get somebody who understands what coming back into civilization was about. And even if the provider or nurse didn't experience it, they can get them in touch with somebody who did. We also have amazing healthcare providers at all of our clinics. The Durham VA happens to be right across the street from Duke. So 80% of our docs also are also working at Duke. And that's true for our nurses, it's true for all kinds of health professionals, social workers, pharmacists. We have partnerships with UNC and with East Carolina University. So we get really great talent to help our veterans. So it's a great place to go.